Welcome back, everyone, to our Unclenched podcast. Today, we are going to talk to a myofunctional therapist or a myofunctional therapy provider. We will get into what myofunctional therapists do and how we utilize them in dental practice. And at the end of the podcast, we'll answer a couple of questions from our lovely listeners. Before we get started, I need to get caught up with you, Alex. What's up? What's been happening?
Well, I guess a lot's been happening because, oh my gosh, the year's just about gone. And just getting ready for the holidays and doing all that kind of stuff. What's been going on with you?
Oh, just busy with the kiddos. They're getting bigger and bigger. And we've done some international trips this year, which were their first. And we did one earlier in May. And I still can't get over the fact, it's been so many months now, but I can't get over the fact that my little guy, he was 5 at the time, he slept the entire flight from
Oh, God
Portland,
bless them.
Oregon to London Heathrow Airport. He fell
God
asleep,
bless.
I know, on takeoff, and he woke up on landing. And I was like, wow, this
Yeah.
kid's amazing. Like,
Yeah.
we thought they would sleep because it was like a red-eye flight, like an overnight flight, but
Yeah.
I never thought he would sleep the entire flight. We were blown away. They're both amazing, but that kid, he's like, if he's tired, he wants to sleep. If he's hungry, he wants to eat. Like, he listens to his
Yeah.
body. He doesn't just keep
Sure.
going. So I'm proud of that little guy. But
Yeah.
what about, I know we usually talk about a patient. Do you want to get
Sure.
started, or should I talk about mine?
You go first.
I'll go first. Okay. So Joey's the nicest guy, local guy here. He came to see me, probably at the beginning of last year, and he was having some pain. His jaw was hurting pretty badly, but he could open his mouth all the way, and just pain. But he said he could like manage it. So I never saw him
Mhm.
again. He didn't take treatment, even though I told him I can probably get rid of your pain. I think he ended up coming back later, and he told me that the pain went away after our initial examination, our initial meeting. But when he came back, it was all back full force and everything was worse. He could barely open his mouth. He's in a ton of pain, ear pain, migraines, hurting to open, shooting pain, all the way from like his jaw into his temple, lots of pain. And so we got him started in treatment. And this one stands out to me because as soon as we put the orthotic in, his pain went down. And it
Sure.
isn't always like that, right?
Yeah.
But it's
Yeah.
pretty
Yeah.
cool when it is. And
Yeah.
so he was like, "Oh my gosh, I love this thing." And so he started feeling relief immediately. So he really stands out in my mind. He's just the nicest guy. And I mean, I get it. I get why he didn't sign up for treatment the first time because his pain went away. I wouldn't have signed
Yeah.
up for treatment either. I'd have been like, "Sweet, it's gone. I'm done. I don't have to deal with this anymore." But poor guy, it came back full force. And but he's feeling better, which is exciting. And what about you, Alex? Let's hear about what's going on
Well,
in your
that's
practice.
funny that you should pick that patient because I had a patient in this week, and you know how you said the pain went away. Well, she was in to see me, and she had pain, but she looked up different myofunctional exercise to do all on her own. This was even before she came in the office, and her pain had cut down substantially. But
Mhm,
she
mhm.
still came in for her appointment, and we looked at the anatomy. We took some cone beam X-rays. We looked at her joint, went through our health history, our dental history, all that kind of stuff. And her bite is just so misaligned, but the myofunctional exercises were helping her. So, but she knew she had structural issues and she knew she needed help. So we're going on. We took a bite and all of that kind of stuff. But that brings me to Laura Hanas, our myofunctional therapist that we have on the show today.
Yes.
Hi.
Welcome, Laura.
Welcome.
So
Thank you.
glad to have you here.
Yes, it's exciting to be here. I'm honored. Thank you.
Well, so Laura, thanks for joining us first off. And we know you're a registered dental hygienist, and I would venture to guess that most of us understand what a dental hygienist does. What do you do as a myofunctional therapy provider?
So a myofunctional therapist is, as you mentioned before, a therapist who works with patients to improve their tongue placement, speech, chewing, and swallowing. So in order to be a myofunctional therapist, you either have to have a dental background, meaning you have to be a hygienist or a dentist or a speech therapist or speech pathologist. So you have to have a background before you pursue myofunctional therapy.
So, Laura, explain to everyone why you became a myofunctional therapist and tell us about like your career path, your family, your kiddos. Like, just tell us all about you.
Okay, well, that's a funny story. So I have worked for Dr. Alex in some capacity since, yeah, 2013.
That's me.
Yeah, that's her. Yep, Dr. Alex. So uh, I worked for her full time. Then I had some children, and then I kind of came back part time to help out when they needed a little extra hand or if one of her girls needed to be off. So I was working in her office on one such occasion, and she had just taken a class with the Breathe Institute, Dr. Zaghi, and he was kind of, oh, I took this class and, he has these myofunctional therapists that help him in his office. And boy, that would really help me out if I had somebody close who could help me like that. And she kind of looked at me and I just turned around like, do you mean me? And she goes,
Yeah.
oh, yeah, I think you should consider doing that. I was like, oh, okay. I'll look into it. She goes, no pressure, but, just check it out. So I did. And I thought it was really interesting. And so I actually went to a day at ICMO when I believe that was a couple years ago and met up with another girl who works at another dental office. And she recommended a course to me that she thought was really good. And I took it. And so ever since then, that's the end of the story. So I've been doing it
It's
since.
like full force ahead.
Yeah.
Wow. I love that. Dr. Alex is an influencer. A really
He
big
really
influencer. I love
he's
it. Well, so what would you say, Laura, is the biggest misconception when it comes to myofunctional therapy?
So I would say the biggest misconception is that people think it's quackery or crazy. They've never heard of it. So you have to educate people on what it is and why it's beneficial. And actually, interestingly enough, they are a group of researchers set out to disprove myofunctional therapy, thinking in their heads that it was silliness. And what they found through their research was that it did make a difference. So they were
Oh,
able to. I have the study. I can send it to you if you want to link it. But it was pretty interesting. So patients did note that they had changes in a positive way after doing. They made up exercises, so they didn't follow my functional program. So they kind of pulled from things here and there and told patients to do certain things. And what they found was that it did make a difference. So that was kind of neat. But
Yeah.
yeah, so just education and informing people, especially because they might have never heard of it.
let's talk a little about the tongue. Can you tell us how many muscles support the tongue?
So, yes, the tongue is comprised of two major muscle groups, intrinsic and extrinsic, inward and outward. Technically speaking, the intrinsic muscles are the superior longitudinal, the inferior longitudinal, the transverse and vertical muscles. And those muscles are innervated by the hypoglossal nerve. And then the extrinsic muscles are the genoglossus, the hyoglossus, the styloglossus, and the palatoglossus that are also innervated by the hypoglossal nerve. In addition to that, the palatoglosal nerve or muscle, is innervated by the vagus nerve through the branches of the pharyngeal plexus. So it's a very complicated structure with a lot of innervations of major nerves. So it's a very important thing for function and otherwise.
Well, yeah. I mean, that takes me back to like memories of my gross anatomy. Wow.
Yeah.
But so
Yeah.
the exercises you teach patients, are they hitting all of these muscles?
Well, so since everything is so connected and all of those muscles work together and function every day, many, many times a day, as you go through a program, my functional program and exercises, all of the exercises build on each other. So eventually, yes, you do get all of the muscles through the various exercises working on whatever needs the patient may have. But yeah, it's pretty neat. And so I'll have a lot of patients say, oh, I did that exercise and I felt it back here, or I did that exercise and I felt it down here. So it's not just moving your tongue. Everything's just so connected that it's impossible not to affect other things.
Mm. And how can people that are listening to this test themselves or their tongue to see if their tongue is like in the proper position or if the muscles are functioning properly?
Yeah, so there's 4 goals of myofunctional therapy. So that's kind of what I always go back to, the basics. So the basic things that we work on as myofunctional therapists are nasal breathing, lip seal, proper tongue resting position, and swallowing. So if a patient struggles with any of those things, they have trouble swallowing, they don't breathe out of their nose, they primarily breathe out of their mouth, or they notice maybe they bite their tongue a lot, those are indicators that something is wrong, and it would maybe benefit them to have an evaluation done to see, what they could do to help.
Yeah. And what are some of the benefits of therapy for children?
Yeah, I love talking about kids because I heard you say you have children, and I
So
have
does
2 little
Priya.
boys. Yes, yes. Okay, I have 2 boys. So, but when you become mother, you obviously love your kids, but then you notice things more,
Sure.
and you can see the importance of starting things early to help them later in life. So I consider it almost like compounding interest. The sooner you invest, the longer it goes, the more you have. So if you can get kids at a younger age and correct those bad habits or put them on a better path structurally, as an adult or a teenager, they're going to just do so much better. So kids that snore, kids that have their mouth open all the time, that are tired, that have teeth that are ground down, all of those things are red flags for, something's not right here. So anytime you can start early, I think that's great. Earlier the better. So yes, I think it's great to, consider what you could do for kids for sure.
Yeah, definitely. My kids are both in myofunctional therapy right
Oh,
now. And
nice.
yeah, my daughter's jaw is really far back and my son has the smallest arches maybe on the planet. And it's
Oh, yeah.
it's just
Poor
wild.
guy.
Like, I don't know if you're
Yeah.
familiar with MyoBrace or if you guys use that,
Yeah.
but the
Yeah.
little
Myo brace, Myo
MyoBrace,
munchie. Yeah.
there's a little ruler that the
Hmm.
MyoBrace comes with, right? And you're supposed to measure from
Hmm.
lateral to lateral on the kiddos,
Mhm.
right? My kids are
Yes.
smaller than the
Yeah.
smallest measurement.
Oh,
Oh, wow.
That is
Yeah.
how yeah. So there
Yeah.
and the person who I was sending the measurements to, she kind of was like, "Are you measuring right?" And I was like, "Yeah, yeah." My kids,
Yeah.
I know they're very small. Like my son is less than first percentile for weight, but he eats like a horse. I don't
Yeah.
know where it goes. It goes into his big curly hair is what I think, but
Yeah.
um yeah, and so I sent her a picture and I should send it to you guys, but she was like, "Oh my God." I was like, "I know. That is why we are doing this."
right,
Why I'm
right. Well,
here.
Yeah.
you're gonna change the trajectory for them for sure. Not only in their appearance and their face and in but their sleeping, their
They're breathing.
all of that, their
Yeah.
breathing
Mhm.
just changes. So I know we're talking about the tongue and what role does it play in breathing? And are you discussing, you said that was one of the things you said, to go and get people maybe a
Mhm.
myofunctional therapist if they're not breathing properly. So can you just kind of elaborate on that just a little bit more?
All right. So, what we mean by proper breathing is lips together, breathing out of your nose. Your nose is a very important part of your body to help filter out allergens and things in the air, but also it helps your body produce nasal nitric acid, which helps regulate a lot of hormones in your body. So, if someone's primarily breathing out of their mouth, they're not getting that production, which can affect all sorts of things. So, the tongue, as it relates to that, if it has a low posture or is very weak, will a lot of times be down, have a more downward posture. So those people a lot of times have their mouth open. So what ideally we do with those patients is consider, do they have a tongue restriction? How can we work on strengthening their tongue? Because if your tongue is up
on the roof of your mouth, your lips will be together. So that is one of the big things we look at and try to help patients with, strengthening their tongue to get it in an upward resting posture and lips together.
And what about sleeping? Do you discuss that with the patients, or do you leave that up to the dentist?
No, actually, that's a great point. Sleep is a very important issue as well. And most adults and even some children have a lot of sleep issues. It's a huge problem in our country, and just for all the patients we see. So if someone does have sleep issues, that is something I ask. So I try to just get to the bottom of it. So a lot of times that might include incorporating other practitioners. Do they have some sort of obstruction that they would need to see an ENT for? Do they have some hormonal issue going on? Is their bite bad? If they're grinding, clenching at night. So all of those things need to be considered. I ask first, and then I try to get to the bottom of, okay, I think this is the issues going on with that patient. And if I feel like they need to see somebody else, I'll tell them, okay, I would like you to see this ENT. I would like you to see, Dr. Alex or a physical therapist or somebody else to help with this process.
Yeah. So I know I send you a lot of adults, and most of our listeners are probably adults. And they're fully developed. So what have you seen with adults? I know we've seen a couple of things together, but what else, what have you seen? Like, elaborate on that, and what do they struggle with, or what do you see?
So I feel like it's either two things. Either they can't fall asleep or they can't stay asleep, or they are not necessarily aware that they snore or mouth breathe, but they just know when they wake up, they're very tired. So a lot of tiredness. They don't sleep well. They don't necessarily always know why. So those might be people that aren't necessarily considered to have sleep apnea, but they might have an upper airway restriction, which I feel like most people at this point have something of that. So it's kind of different, but a lot of tiredness and waking up a lot. So those are the two big things.
Yeah. So I was reading, and you might have been in the office when you heard me say this, but when I was reading an article, really just literally like 2 days ago, and it was a study from Stanford, and they were saying that with the proper tongue positioning at night, like 50% of the AHI index would resolve on people if they could just get their tongue strong enough to stay to the roof of the mouth. And once you exercise it, that's where it wants to go to. But I thought that was like telling, because a lot of people think they have sleep, and they do have sleep. But if they get that tongue under control, they themselves can help their sleep out, and maybe not need a whole lot of other therapy, and get that tongue strong.
Right.
Just a little.
Yeah, I have a patient who has an Aura ring, those rings that a lot of people have now. And she said that when she does her tongue exercises, if she does them before bed, or if she's very consistent with them, her sleep significantly improves because her tongue is always up. And when she falls back or gets lax about it, then it's poor. So it's kind of neat, just a little anecdotal.
Those rings are really cool. They can,
yeah, they are. They are.
Yeah. Well,
they really do.
Yeah, definitely. We're talking a lot about the tongue, but what about the lips? Like, where do the lips fall into this whole complex?
Right. So your lip seal is very important, obviously, too, because if you don't have a good lip seal, your mouth is still open. So I did have a patient try to tell me that although her lips are not together, that she still breathes out of her nose. And we had to talk about that.
Liar, pants on fire.
Right. Yeah, she was really trying. So we had to work on her lip seal. So when we work on lip seal, there's a muscle that goes around your lips. It's called the orbicularis oris muscle. So a lot of patients that have an open lip posture have a weak muscle. So in addition to working on strengthening the tongue, we have to strengthen the muscle around the lips. And I have certain exercises I use for that. Now, everybody's different. Certain patients really struggle with keeping their lips together. And although the exercises seem simple, when I give them to them, they always say, "Oh, that was really hard," or "That was a really good workout I had to do to work on that. I can tell my lips aren't strong." So yes, that's another important component of what we do.
Okay, so we mentioned the tongue, obviously, the lips. Now, what about the swallow? When I check a patient's swallow, sometimes I'll see like their neck engage. And I'm like, what the hell are they doing here? So what's going on there, Laura?
Yeah, well, swallowing also, you do that throughout the day about on average 580 times. So
That's a lot.
you do that a lot during the day. So if someone has a very strained neck or really struggling to swallow, a lot of times they have some sort of improper tongue habit or position that's happening while they're doing that. They could be a tongue thruster where it's going forward. They could be laterally thrusting where it's trying to be flat. Ideally, it should be up and it should be a very relaxed swallow. You should not be straining or really struggling to do that. A lot of patients also don't chew their food enough. So,
Mhm.
if you're not chewing your food enough and then you're trying to swallow something that's partially chewed and also you don't have a good swallow pattern, that's just a recipe for having a bad time and needing some help. So I do have a lot of patients that say that their swallowing is not good. They feel like they choke on things a lot and it makes them feel very panicky. They
Mhm.
don't like that sensation and they say, I don't like how that happened. I want to fix that. So yeah,
Mhm.
very, very
It can
important
be
to get
very
that checked out.
claustrophobic. Yeah.
Right.
Yeah.
Yes,
Yeah.
absolutely.
And
But one of the things, and I don't know if I probably talked to you about this, but someone, maybe it was even you, like for someone to test at home too, because you said they don't chew their food up well. Whenever you're chewing, I think it was you, but have a patient check their own tongue, like chew the food and then check their tongue to see if the food's in the middle of their tongue or something like that. Am I
Yeah,
making this up or?
to form a bolus. It's called a
Yeah.
bolus. So you would chew your food up enough that would be in very small particles and it can form like a bowl-like structure. So you should be able to chew your food up to the point where it will kind of get together in a bowl formation and then it can sit on your tongue. So if that patient can do that, you know that they can form a bolus, which means that they can chew their food up enough. Some
Right.
patients, again, although that seems like a very simple task, some people can't do that and they just don't have the habit of chewing enough. So
Yeah.
they
So
would
if
need
they stick their tongue out, the food would
Mhm.
be down the middle of their tongue as
Right.
opposed to
So
all over their tongue.
right.
So
Yes.
that's a good test at home to see if your food's all over your tongue, you're not chewing right. You need help. You need Laura in your life.
Yeah. That's right. Give me a call. I'll help you.
and I know we kind of touched on this before, but for those listeners that where all of this is like new to them, I just want to clarify, like, how should we be breathing? We never think about it because it's something we do. I mean, we have to breathe to stay
Mhm.
alive, right? But where
Yes.
should the tongue be? How should the lips be? What should be going on when we're breathing in an ideal world?
Sure. So a lot of times what we tell patients is lips together, your tongue up to the spot, meaning your tongue needs to be up. But a lot of people don't understand that that means it's not just the tip of your tongue. So I think people think, well, my tongue is up and it is up, the tip is up. But ideally it should be all of your tongue, most of it. So the tip, the middle, the back in a resting posture, lips together, breathing out of your nose. In addition to proper tongue position and lip seal, breathing, we have a tendency to overbreathe, especially in our country. So people think they need a lot of air. So they like this. If you just slow your breathing down, belly breathing, it's not a superficial breathing, it's deep breaths. You'll find that you don't need to kind of do the panicky breathe.
Mhm.
It slows everything down. So that's what I would say. Your lips should be together. Most of your tongue should be able to be up, and it's kind of a relaxed, controlled breathing, not a panicked, really quick up and down. It should come from your belly and really be
Right.
able to engage. Yeah.
The belly is key. So
Mhm.
when you inhale, if you put your hand on your belly, that belly should come out.
Yes.
Right.
Yeah.
Yes. Yep. Absolutely.
And I know
Yeah.
you can't give away all your secrets or all your magic tricks, but what are some basic exercises in your wheelhouse that benefit our myofunctional abilities?
So I always have patients see if they can do, I call it a lingual palatal suction, but I think it's given different names, tongue push up or tongue cave. But basically, if you look in a mirror, can you put all of your tongue up on the roof of your mouth? Right, like Dr. Alex is doing. Create a suction. So you, excellent. Look, both of you did very good. See,
Good
look at your lingual palatal suctions. But there's so many people that really can't do that. And it seems so simple, but they really do struggle. They can't get it up, or they think they're doing it, or they're really strained, so in addition to getting your tongue up, you really, it really shouldn't be like you're forcing your head out here and or pushing your tongue. So just as Dr. Priya and Dr. Alex just showed you, creating that suction, holding your tongue up, I think that's a good fundamental starting point. Can you do it? If you can't do it, can you work on getting it up there a little more? It's a good strength, toning, and control exercise.
Yeah. So I've seen a lot of bad bites. You've seen a lot of bad bites in my office and probably elsewhere too. And when patients have orthodontics and teeth shift or moved, or they create an open bite where those front teeth don't touch, the patient always blames themselves for not wearing the retainer. And I explain it's not your retainer, but the orthodontist doesn't want to take the responsibility either and says, oh, well, you haven't been wearing your retainer. And I explain it's not the retainer. And even sometimes they have a permanent retainer inside their mouth, but they still move their teeth. So explain what's going on there, Laura.
So a lot of times when that is happening, that is because your tongue is creating some extra pressure somewhere. So it's obviously not in the right spot. If it were up in a resting posture, it wouldn't be pressing on your teeth. So your tongue is a very, very strong muscle. And I think people think, well, how could my tongue do that? But it really can. It's very strong. The bone in the teeth will always follow the pressure. So if your tongue has a constant applied pressure in a certain way, whether it's outward or frontward, your teeth will move. It can move your teeth. So people that have an open bite a lot of times have a tongue thrust. Their tongue is constantly pressing and pushing forward. So eventually the teeth move and you have the space. Or your tongue is going in between your teeth. And again, it'll push your teeth out of the way and then it'll eventually rest there. So those patients have some other underlying issue going on. Obviously, if they're wearing their retainer, their teeth should not be moving.
Right.
And if their tongue was in the right spot and not pressing on those other areas, then your teeth still would not be moving. So you have some sort of dysfunction.
Yeah. And with the anatomy lesson and all the muscles of the tongue, well, that's a pretty strong muscle. So it is going to move your teeth. And it's just, I've had people in braces that are like, I can't close your bite down because your tongue's in there. And they're like, oh, my tongue's not in. They take offense to it. I'm like, no, you just need myofunctional therapy. And just like the patient Donna I saw the other day, I'm like, hallelujah. Yeah. We closed the left side because she started doing her exercises again. Yeah. And it's like, finally, the light bulb goes off. Okay, you're right. And I'm like, okay, let's say that one more time. I'm
okay,
right.
I'm right.
Yeah. I had a patient that Dr. Alex sent to me, and she told me when I was done with her therapy that she only wished that she would have listened to you sooner because she felt like it really helped her get her braces off quickly.
Right.
Like, I really wish I would have listened to them because it really did help things move along.
Right.
Totally.
Right. I know we've had a couple of those.
Yeah. So it does. It makes a huge difference.
Yeah.
And can you explain a tongue tie and what should be done about it?
So there's 4 classifications of a tongue tie. Class 1 is mild. Class 4 is severe. So most people have some sort of restriction. It's just, is that patient someone who can maybe overcome that a bit with some exercises and get a better range of motion? If not, then there needs to be consideration to have a frenectomy or a tongue release, because no matter how amount of exercises or work you do, your tongue is just not going to be able to operate in the most ideal way. So you need a little intervention that way. So
yeah,
that's what I would say.
So you know me, Laura, and I love that fascia, And
She does love the fascia.
Yeah. What are your views on the fascia? The fascia is the covering over your muscles, like if you were cleaning a beef tenderloin, in that silky grayish fascia
Yeah.
covers the muscle. So you have that in your body too. So, what are your views on the fascia under the tongue and the body connection? And yeah, that's just one of my favorite things to talk about.
I know it's so neat though, because it's so connected, because your tongue is connected all the way to the tip of your toe by one big fascial plane, like one whole connected plane of muscle fibers. So
Mhm.
if you have a restriction in your tongue, it could potentially affect other areas of your body. So again, a lot of patients that Dr. Alex has done releases on tell me I don't have the tightness in my shoulders. I don't have the tightness in my neck, because that fascia is so connected. And when you release some of that tightness, you can eliminate tension and tightness in other areas, which is really, really neat to see. But because
Mhm.
it's so connected, it's just so important to take care of it, because it can affect so many other things. It's not just your tongue. It's just everything in your body is so connected.
Yeah,
Yeah.
definitely. And with some of these patients, do you ever work with a speech therapist?
So actually, I like to collaborate, just like you ladies like to collaborate. So we have a couple of similar-minded practitioners in the area, and I've talked to one girl, and I really like her. She's great, and she is a licensed speech therapist, as well as she does myofunctional therapy. She kind of specializes more with kids and infants. But if I needed some help in that area, I could work with her or send those patients to see her for those things. And I obviously don't have a speech background, but I do think it's important. But if there's a child or an adult with some sort of speech issue, I always think, what does their tongue look like? What does underneath their tongue look like? Have they ever had a release? Most of them have not. They always tell me, I had speech therapy as a kid. I really struggled. I had this. And nobody ever looked underneath their tongue, which is a little bit hard to believe, because you would think that would be the first place you would go. Because if someone has a severe tongue restriction, they just can't move their tongue up. So if you say S, your tongue has to go up for that. If it's tied down, it can't do that. So a lot of those patients have an S issue or saying certain words. So that would be my first go-to, is check their tongue. But also, if we need to incorporate some sort of speech, I do think that that's obviously helpful to have a practitioner in that way. So it's nice to have other like-minded individuals to chat with and help each other out. So
Yeah. Yeah, I know we talked about the tongue position. We talked about the sleep. We talked about the tongue tie and the tongue release. And it's just, I just want to really beat into people's minds that myofunctional therapy does help with the airway also. And so it's so important, if you're going to start looking at your lips, your tongue, your teeth, your jaw, you can't forget how the tongue's operating. And I just think that's really, really important to point out. And thankfully, we have Laura, and that. So I'm real happy you're here today.
yeah, it's I wouldn't be here without you, Dr. Alex. So I mean, I wouldn't have been probably doing this without your, you know,
Pushing you.
helpful hand. So it's good.
And and if the airway is corrected, would the forward head posture correct or improve? Like, what have you seen with that?
Yeah, so forward head posture, again, you'll look around, so many people struggle with forward head posture, and a lot of that is airway, but all of it's so related. So if someone's head's out here, and it's heavier out here, if it's supposed to be above your shoulders, and I don't know how, just a few pounds. As it goes out, it gains like 10 pounds extra the more forward it is. So if someone's really struggling to breathe and their mouth is open, their airway's bad, they're gonna eventually, you'll see that kind of sloping, slanting head posture. So all of that is so connected. Again, what's your tongue doing? Where's your tongue at? Are you breathing out of your nose? And if you correct those things, yes, I've seen people's posture improve,
Oh,
especially like
yeah.
a lot of Dr. Alex's patients, like after they've had their bite fixed and they've had their appliance or whatever they do, and then they're breathing properly, they're breathing out of their nose, you can really improve that. You can do a lot of things to help with that, which again is so important, because it not only does it affect your breathing, but then your head can have tightness in your shoulders. If your head's out here and you're carrying it out here all the time, it's so important to try to improve that and help with airway.
So here we are again. We're just trying to connect the head and to the rest of the body. And Laura, thanks so much for being here and helping us understand a little bit more deeply the connections, not only to the tongue, to the oral cavity, but how it plays a role with the rest of the body and that wonderful fascia that I always like to talk about. So let's take a couple questions. And Laura, you help us out and answer some of these, okay?
Okay.
All right. Well, first question, I have to get to a tongue tie release, or I have to get a tongue release. Why can't I just get one? I don't want to pay for myofunctional therapy. Laura, that's a good question for you, I think.
That is a good question. And I can understand why someone would not want to incur an extra expense, but it is so important. If you don't do any sort of therapy before a release, the actual procedure just does not go well. There's typically more bleeding. Their tongue is not strengthened or knows where to go. So you really do need to work on toning and controlling your tongue before and after. So in addition to doing that after your release, your tongue, if you don't change any habit, is just going to do what it's always done. So if you had a low posture tongue, it's going to stay low. So you do need those exercises to continue to strengthen it and retrain how it functions, so you get the best result from having that procedure. If you don't do those things, then you're almost kind of wasting your money, because you're doing something that could really benefit you if you did it the right way. So I know I can understand the hesitation, financially, but it is worth it to do it the right way. Just look at it as an investment. And if you don't do it the right way, then you're really not helping yourself in the long run.
Yeah, that's, I think, is a perfect way to put it. And just like Priya and I always say, your muscles have memory. Mm-hmm. So if you don't teach it something new, it's just going to flop right in the floor of your mouth or do whatever it's been doing. So we gotta get it to learn how to do new, because I agree with you. You don't want something to fail, and you're setting yourself up for failure if you're not doing it the right way.
Sure. And just because you get the tongue tie release doesn't mean your tongue magically knows how to sit in the correct posture when it's been doing something different for so many years, right? So totally. I think it's a good investment.
Right. So next question. How young can you start myofunctional therapy? And not sure that my kid, 7-year-olds, will sit for therapy.
So I think that I've had younger kids that have done it. You have to change how you do it a little bit. Mm-hmm. You really have to, consider that it's a child and they don't have the attention span as an adult would. So, you might have to make it a little shorter, but kids can do it, especially if their parent is willing and able to help them, give them reminders and keep them on task. Kids are very able to do it, and they want to do those things. They want to meet and show you what they can do and how good they're doing. And they get very excited to do what you're telling them, and you're working towards a goal. So I don't think 7 is too young. I actually think that's a great age. My son's almost 7 and he can do things. So I would start as young as you could, but you have to tailor it to the child and, do what's best for them. So but you can absolutely.
My kids are 5 and 7, and this is the second round of myofunctional therapy for my daughter and the first for my son, and he's the 5-year-old. But the first round of myofunctional therapy was done with a different provider, and I just think the exercises were too long. They were all like 5 minutes, whereas this new person makes them like 2 minutes or 3 minutes max. 3 minutes max, and like a few rounds of those, but it's much more doable. A minute is a long time in a kid's life. They can't sit still. And so my son, they would just whine and complain about the 5-minute long ones, or my daughter would. And so now it's they still whine and complain a little bit, but it's going a lot more smoothly. But we sort of bribe them. I'm like, I don't care. I'm not a bribery.
The reward system. It works, right?
Totally. Yeah. They have this.
I'd bribe my kids.
I totally bribe them. And They have this one appliance that they have to hold in their mouths and like press down on it to strengthen these muscles, right? And they at the same time they're
Yeah,
pushing their
yeah.
tongue up against another part of the appliance inside their mouths. And when they first started doing it, it hurt so much. Like it was just so hard for
Mhm.
them. They were like, "This is so hard. This is so hard." So I was like, "You're gonna get a cool toy from Target if you can do this." And they really
Yeah.
committed. And now it's like easy for them. So
Mhm.
like,
Mhm.
yeah, bribery works.
Oh
It
yeah.
does. I
Hey
agree.
Laura, before we go, tongue release on infant.
Yeah.
Now,
Yeah.
because they can't suckle or they can't eat, but a lot of people don't realize that even if you get your tongue release on an infant, there are certain stretches you need to do for your infant, right?
Yeah. Yeah, that happens a lot. I think if providers or doctors or whoever do the release, they don't necessarily say, oh, you have to stretch it or you have to massage it or whatever the case may be. That is really important because it has the potential to reattach if you don't do those things. So, although
Mhm.
they're an infant, the parent, the mom,
Right.
whoever can still help with that, give it some stretching, massage to help kind of keep things as they should be and not
Right.
reattach. So, yeah, for
Yeah.
sure.
Those are neat tongue releases though to do on an infant, and then they
Yeah.
immediately latch on to the mom. I mean, like
You've done
it's
a few
kind
of
of
those, right?
yeah,
Yeah,
it's
yeah.
kind of emotional. Like you're like, oh,
Yeah, I
you
just
see
helped
that
them.
that baby connection, and you're like, oh, that's so
Yeah,
cute. Anyway,
yeah,
well,
that's
listen, this
awesome.
has been, again, a lot of good information, Laura. Thank you so much for sharing everything and taking the time away from your kids to be with us. And I so appreciate you in so many ways.
And thank you.
Aw,
Yeah,
thank
thank
you
you
so
for
much.
taking time from your busy day. Any final words of wisdom?
Well, thank you very much. I really appreciate it. And it was really nice to be on your podcast. So thank you for inviting me. But I would just say that although it seems silly and insignificant, your tongue is a very important part of your body. And it's really the entryway to your whole body, your tongue, your mouth. It's so important. And I am a Christian. So in the Bible, it says, the tongue is a small member, but it boasts of great things. So, you kind of see symbolism in there just with how you speak your words, how you can
Yeah.
affect other people, but also in addition to that, how it functions and how it helps your whole body. So do not underestimate your tongue. And if you think you need some help, then obviously reach out to my functional therapist. I think it would really benefit you. But thank you
How
so
can
much.
someone find one? How can someone find a myofunctional therapist? Is there a website? Is there anything like that, or just Google?
Right. So there are a couple of different courses and certifications you can get. I went through Sarah Hornsby's course, so she has her graduates listed on there. I believe the Breathe Institute might list their MyoMasterminds as well, and the IAOMT has their graduates listed on their website. So I think any of those resources would be good to find someone locally to you. They list their graduates and where they are, and so you can connect with someone. Just a simple Google search, myofunctional therapist in my whatever area you're in would probably do it too. So Google knows everything now, so they could probably stick with them. But yeah, those are great places to go.
Okay. All right. Well, thanks again. And I hope everybody learned a little something, and hope you tune in for our next podcast.
Yes, come back.
Bye-bye.